As students, parents, and guardians get back in the swing of school routines, what should be on their health checklists? From immunizations, mental health check-ins, to nutritious lunches, there is a lot to think about for everybody. Joining us now is our CBC Health columnist, Dr. Melissa Lem. Dr. Lem, let's start with vaccines. Back to school, lots of kids. What do parents and guardians need to know about making sure that everyone's up to date on the shots they need?
As you mentioned, Dan, this should be part of every single family's back-to-school checklist. Backpacks, school shoes, pencils, erasers, vaccine update, check. And it's especially important this year because over the past 5 years, vaccination rates have dropped. So in BC, we have a target of by 2025, hitting a 95% vaccination rate, which is good for herd immunity. But right now, for most vaccine-preventable diseases, we're sitting only around 70% vaccination rate for school-aged kids. And so kids today are at higher risk when they go into classrooms compared to before. And we know some of the reasons for this are early on in the pandemic, people had less access to their family doctors and public health clinics where they could get vaccinations, but also unfortunately growing vaccine hesitancy because of a lot of the information that's out there. So if you don't know if your child's vaccinations are up to date, check with your family doctor if you have one, or your local community health center or public health unit to make sure that your child is protected.
And fair to say that a lot of the information out there when it comes to vaccines may be misinformation as well.
That's right. Misinformation and sometimes deliberate disinformation too.
Let's pivot to something else. Some high schools encourage students who are 17 and above to donate blood. If somebody considers that, it's not for everybody, but they do certainly encourage it, what should a student and their guardian know?
Well, first of all, huge kudos to you if you are contemplating donating blood for the first time. This is one of the most selfless and helpful things that you can do. Every time you donate blood, you can save up to 3 lives. But if you think about it, the path to donating successfully starts a few months before you actually donate. You want to make sure you're eating lots of iron-rich foods to make sure you're building those red blood cells to donate. And then in the week beforehand, drink lots of fluids. And then right before you donate, make sure you eat a salty snack. This is one of the few times that we actually recommend this, to make sure that your blood pressure is high enough. You also want to keep in mind that iron deficiency and anemia, which is when you don't have enough red blood cells, can become one of the most common side effects with blood donation frequency. So if you're a young adult or you're donating more than 2 times per year, make sure you check with your family doctor what your iron stores are like at least once a year to see if you need supplementation. And
having done this, there is a lengthy checklist of questions they ask you. And so it's not guaranteed you may be able to donate, right?
That's right. It's almost like a mini checkup when you go. They check your blood pressure, your hemoglobin, they check for infectious diseases. It's actually good for your health to donate blood.
And lastly, we appreciate your time. Sleep schedules. It can be tough to come back from summer and a little more easygoing to the stricter schedule the schools provide. What are some tips that you offer to the students as well as to their parents and guardians?
Well, we have to remember just to follow Health Canada guidelines and also set up a routine, which is easier said than done. I have a 9-year-old myself. But with sleep, we forget sometimes that school-aged kids need, on average, about 10 hours per night to make sure that they're well rested and can focus at school. And then other aspects of health come into play, like making sure they're eating healthy vegetables and fruits, high-quality protein, healthy fats to fuel those bodies and brains. And then you want to make sure that they're getting at least an hour of exercise per day. This is more than adults need, in fact, to make sure that they're getting enough energy and then are tired at night. And last but not least, more green time and less screen time is really important for their physical and mental health and to make sure that they get a good night's sleep as well.
Dr. Lem, we appreciate your advice and your expertise as always. Thanks.
Thanks, Dan.